So next up, very excited about our next speaker, Kunal. I think many of you know him already, but in this context, we're going to have a really great conversation and discussion about a coordinated effort that Kunal's been leading called the Rapid Solvers, and in specifically how the community and industry are working together in this case, to quickly prototype, test, and produce equipment necessary for our response. And Kunal, are you ready?
Yes, can you hear me, everybody?
Yes, we
Okay,
can.
wonderful, wonderful. Thank Venture Café for inviting me to share the experience what we are having recently with the COVID-19 pandemic, and again, this is not my work what I'm going to present. This is actually a work of a lot of people. I am here as a spokesperson and trying my best. I don't have the knowledge of whatever I'm going to present right now, but I have gathered this knowledge through the lot of conversations that we had on on weekly basis, that we are actually meeting and discussing about problems and how we are trying to solve them. So I'll jump directly to the slide, and I don't do things like this normally, but this is, I think, we all started to do something which we do not do nowadays, and here we go.
And Kunal, while you're queuing that up, I just want to say, just for everyone to be aware, this is like live design thinking. You're witnessing it, and Kunal's been leading the charge here. So when you hear in the innovation space things like design thinking and iterative agile process, this is it, like literally. So I'm really excited for Kunal to share this real-time innovation and how it's working and how it fits in with ultimately a handoff or a handshake to industry. So there's nothing better than seeing it like live unfolding right in front of you.
Yeah, completely agree, Jeanette. That's actually the perfect way to say that what we are trying to do right now. So I'll just jump right away onto the important part. I hope you are able to see this. We all see, I think, every day, but I want to kind of give you a particular focus in the in around here. The time during the middle of March that when US did not pick up a lot of traction, but in Italy you can see that they had early March, from that onwards they started to have a huge amount of spread, and that's why they had the death toll started to increase during that time, and we were all closely noticing that sitting here in US. So one second. So here, what we were noticing sitting back, we saw the ventilator crisis. We saw 3D printed, technologies coming out in the newspaper about, they are having a crisis on the valves. So people started creating valves out of 3D printing technologies. They started to also create a wide splitter. So I'm talking only about the all Italy related things, that what they did a few weeks ago, or even more than a month now. No, sorry, more than 3 weeks now. So they started doing all this kind of development, because they had a dire need to do all those things, and they had much more patient than the amount of medical supplies as well as the medical equipment in their hospital. And on top of that, the personnel, medical personnel, were also facing with the personal protective equipment. So we were closely monitoring all these things. And I remember that on March 19th, that we had actually a meeting first time with some of the URI folks and Brown University professor together, and we met on WebEx, and you can see that it's March 19th, which is somewhere over here. And now we can see that in today, this is actually today's graph. I got it in the morning. So we can see that what has happened since March 19th to today, and it has exponentially grown in US. And this is what we were having a fear at that time on March 19th. And I think not only us, but entire country was having the same fear. So what we did at that time on March 19th, that it was actually not me, it was Bill Oley. He's a professor, long time professor at University of Rhode Island, and in our department. So he called on a meeting, and he said that, guys, do you want to talk something that we can work together right now, and we will be expecting something, a big thing happening in US now. So we should at least start preparing something on several fronts. So we found out that he was more interested in ventilators, and then we also talked about the face mask. We talked about 995 materials. So all the faculty, they come from a different department, and also we had epidemiologist on board too, Abdullah from Brown University. So we were all kind of talking about what we can do next. And this meeting actually ran for 2 times with the same number, and gradually we had numbers increase. So we started to call it in the Rhode Island rapid solvers. And our mission was essentially to bring different expertise together and try to see what are the needs on the maybe state level or community level, and what we can do in response to those needs. And this is something which we were kind of thinking to do together. And again, my whole approach at that time to kind of create a platform that we all can communicate. So I think Venture Cafe would be in a right, I would say, the kind of a platform, something similar we needed also for rapid solvers, that we can create some kind of platform that we can start communicating. So we started to do a lot of meetings as well. So right now, like Annette mentioned that we have, so I just counted this morning, we have 80 plus members right now on board with us, who are all coming from a different background. We have universities, we have hospital, nonprofits, industries, makers. And I would like to thank particularly to the RI Hub actually over here, that Annette was playing a big role in connecting us with all these individuals to bring them on board, and we can kind of chat. So what we do, so the thing is that we do our WebEx meetings. Actually, we were supposed to meet at 5, so we're gonna postpone our meeting to Friday now, and discussing about all the recent development happening. And brainstorming is the thing what we get started with first. That if there is a new idea coming, for example, if there is a new face shield or face mask, model coming out in the market, somebody is putting it as an open source, then we take it. Doesn't mean that it's going to be useful, because we had that actually experience. Initially, we started with the one face mask, and we identify after printing those face masks, we identified that it wasn't perfect fit for the for the medical needs. So like that, we started to learn even more after printing some of these things. And other thing is the identifying the needs. Well, the other part was the also checking on the progress, what is already we have identified, what we are trying to fabricate, and after fabrication, whether how we are going to ramp up the production. So, and do we have enough 3D printers and whom we can invite? So a whole lot of things. So I'm going to chat a bit about that. What kind of projects we got started, and what did we do with that? So speed of innovation. I like this title. Thank you, Amy, coming up with this title. This is something what we really did. So speed of innovation. The first innovation what we were working on was personal protective equipment. And if some of the folks, if you do not know what PPE is, PPE are the kind of equipment that the medical workers, they need them when they are treating patients, and there are a lot of this equipment they need to wear. And again, we were more interested in something that we can help with, and we started to look at that there is a lot of open source information available online. So we did not need to re-engineer anything over here. We needed to find something which is available out there, but yet we needed to modify sometimes those items. So I'll show you. So we actually selected that we will only currently work on face shields and face masks because of the amount of people we have in the group, and the kind of the equipment we have available to create something and helping with the needs. So here is thanks to Seiji from Fab Newport. Fab Newport has been in the forefront of all these things. They have a lot of 3D printers, and so here you can see the design 1 in the left, design 2 on the right, and you can see that these both are actually perfectly working fine. But this both coming from a different sources. So we actually and again, the people who came on board with us, they all had the different designs. So they were bringing those design to the meeting, and then we were discussing about that. And some of the designs we had to eliminate. There were also other things that we had to, not only 3D printing material. 3D printing is one thing, but what about having this glass transparencies that you need to put in the front? So what kind of materials out there which are available in the store or online stores? We had to also wait. Sometimes we found in a big roll of plastic material, then you have to do a 3D cutting. So lot of the iterative process that had happened, like Jeanette mentioned, that was very important over here. And we need to remember one thing is that we all are social distancing. This is not something that you all are sitting somewhere going with all the 3D printers and we are sitting next to one another and we're gonna have this produce come out together. So this is one more challenge that we have been facing, and we are trying our best to kind of working even remotely. Still, we are able to produce these items. So this was actually working out well, and especially I have to thank all the 3D printing community over here that who are, I think, sharing their calendars. They are maintaining social distancing while accessing the shared 3D printing facilities. So it is really interesting. This is actually the photograph coming from a maker space. Erica Usman has created this 3D printing shields in the library at URI. So they also ramp up all the production. This is actually our just 2 days ago URI delivered somewhere around 50 to 60 face shields to the South Kingstown Emergency Medical Services. And this is, you can see, these are the two, delivery boxes that were picked up by the South Kingstown Emergency Services. And we have created a 3D printing farm. Actually, it was an idea of Phillips, Brennan Phillips, who is our ocean engineering faculty. And he said that it would be more efficient to bring more 3D printers in a same building, may not be in the same room, but same building. And then you would have those access to the more number of 3D printers, so you can make your production more efficient. So because of that, in recent 1 week, we have a much better production compared to the previous week when we were working and trying to find out what we should be doing together. And I would like to also, mention that the Dr. Valerie Tanya actually is our currently a director of the newly designed 3D printing farm. And also Jeanette has kindly provided the space in Loft for creating 3D printing farm over there as well. So I think we will have a several different, and plus Newport, Fab Newport already have 3D printing farm, so-called, because they already have a lot of 3D printers. So this is something which is very interesting, and it sounds very simple, that what is a big deal in face shields, but actually when somebody creates it and then you realize that there is a lot of modifications you need to make, and you need to make it, if the people who do not know why the face shields are required by the medical personnel. So the reason the face shields are required, even though you wear mask, on top of that you need to wear face shield, because these patients, when they extract any kind of droplets while they are coughing, or due to the ventilator tubing change, those can be going onto your face, and you can protect yourself using the face shields. So that was interesting. The another thing was the face mask. Face mask has been extremely challenging, and that is especially in the 3D printing. Of course, if you take a look at the face mask in terms of the uh, fabric or textile manufacturing point of view, then that is a different case. But here we are looking at the 3D printing design more for the medical personnel. We are not looking at the face mask for the general population. So we started looking at a lot of available masks out there. We identified this Rowan mask. That is something which is more, we would say, might be a good fit for what kind of thing what we want to do. Brian, you are there. If you have any comment, please do come and chime in and provide more information. So Brian Jepson, Dylan Costa from RISD, and Dr. Greg J from Rhode Island Hospital. Sorry, I have a typo there. So
yep.
They are
nothing to add.
doing the
You've covered everything. Covering everything with a
thank you.
slide.
So what I have heard from Brian, this is actually Brian's. Brian has been kind of communicating with me recently, and essentially the idea is that this particular mask, the main problem we face is the fitting. So there should not be any air gap when you are wearing the mask, and so there are two critical points here. One is the air gap. That means a fitting test you need to do. And other thing is that what kind of N95 material you are using, that you are breathing through this window. So here you have a window and you would have an N95 material there. So there is this called Bitrex test, which is essentially in a smell or odor test that you need to do that for fitting test. But this is a qualitative fit testing. You can do a quantitative, but I think it is a little challenging right now to do such kind of thing. But Dr. J is so generous to kind of work closely with Dylan from RISD and finding out at least do the qualitative test on this.
Just one quick comment on why the quantitative is probably not possible. Certainly not impossible, but impractical without modifying the design, because that does require an attachment to be pulling air from the mask while it's on the person's face to see if any of the materials are getting through it. And so the design would have to be modified probably radically to support that.
Perfect. Thank you.
Welcome.
Brian. Another thing is N95 equivalent materials. So if you might have seen a lot of web recently regarding you can make your own face mask, and maybe you can use that face mask and go anywhere. So this is a scientific question, right? How effective these face masks are when you design your own face mask. So regarding this particular question, there is one team that is working at URI, Dr. Sodi and Irene. They both are working on an interesting, very quickly designed project. This is nobody knew something about such kind of principle, that you can actually use a smoke to test an N95 kind of material. So what they have done over here, if you look at it, there is an incense smoke chamber. You create a smoke, then you have you have a material in the middle, and then you, on the other side, you have a smoke detector, and on the other side you have a vacuum pump. So as you puff the pump, you will be sucking the air inwards. So that means the smoke should be coming from the smoke chamber to the smoke detector chamber. And how many puffs it takes for this particular material to pass through, right? So if you have a stronger material, something like an N95, it would require much more puffs to pass through. That means that material is very strong to be used as a face mask. So this particular test, they have been doing a lot of labor work along with not just creating the technology, but also you have to run these experiments in the lab. So they did this N95 material, which is certified N95 material that came up with the 300 puffs. But if you use paper towel, 6 puffs, boom, you are completely unprotected right away. Surgical mask did not give you good protection. It had only 8 puffs. You have a cloth masks, 7 puffs. So if we are thinking that we would be so safe going through the in-home mask, but of course it may be still productive, because if you have a larger droplets when somebody is sneezing around you, and if you have larger droplets around you, it may still kind of be a good protection rather than you are going without mask, right? They identified the paper mache. It has some good quality of a material, and HEPA filter has been so far the best, which has outperformed even an N95 sometimes. And they also found out some new nano electrospun materials, very thin fibers created through electrospin and spinning technology, and they have a very high rating for that, the 500 puffs. So again, this is not an FDA approved project or anything like that, but these are something that in very innovative project that was created, and these are all the results just within 2 weeks. So we started this group on 25th of March. So it's exactly 2 weeks today. So this is all things what you are seeing is that within 2 weeks. They are starting a YouTube channel, and that will come out soon, and we will be spreading that, distribute that information with everyone, so you will get to know what kind of materials are useful when you want to make your own mask. And the last 2 slides I have now, and I'm going to the ventilators wide splitter, and particularly when you have more number of patients and less number of ventilators in the hospital. And for example, in New York City right now, they need to use the same ventilator for multiple patients, unfortunately. And so in that case, you have to provide wide connectors from one ventilator to multiple patients. So that is something ongoing process, I believe, also in Rhode Island, just for the preparedness. Over there, Aiden Petrie has been working in this particular thing. Brown University is involved. Rodrigo and Jeanette have been involved. From URI, Brennan Phillips has been taking charge, and he's designing some of this Y splitter using the 3D printing technology. Again, the normal 3D printers cannot be used in this kind of in particularly when the air is going in patient's body. So that's why you have to have a high quality 3D printers. And again, there is very recently the Vesper got the FDA approval, and they have provided their design for the Y splitter and what kind of 3D printers and what materials you can use. They have provided.
Can I ask something quick?
Yeah.
So I think one of the reasons why you don't want to use the 3D printing because of the particulates that will go potentially inside of the body of the patient. Have you guys been considering maybe applying a coating to it that would prevent the particulates going inside the body of the patient? And that way you could use actually the simplistic 3D printer to become a valid product to use.
Excellent. I think that's a very good point. So Brian, I think we may like to take this to tell our community that the coating might be an interesting idea.
Yes. Yeah, there are a number of options there. Thanks, Peter. Yeah, there are a few things, different materials that we use, like different sorts of paints, finishes. So yeah, that's definitely sealing it, avoiding particulates would be absolutely essential. There are some biocompatible resins that are available. I know that Form Labs, for example, has set up an FDA approved site, and they're actually 3D printing swabs with their resin printer. And I'll see if I can find that link because it's quite fascinating.
Yeah, resin printers have been resin material have been kind of recommended too in the FDA approval process. So no, I think this is an important topic. The another thing is the other than the vice splitter, and vice splitter again, it is under FDA related processes, so they have to maintain. And we are kind of less involved. The state is more involved in that, and we are. But Brennan has been continuously working with the state people as well as the Rhode Island Hospital in that. The another thing is the emergency ventilators. You might have heard that there are a lot of open source ventilators that have been created. MIT event project is one of them. It's emergency ventilator. That means when there is no ventilator available at all for patients, can there be a simplest ventilator provided to that patient, and at least that patient can be saved. So same thing, there is a Rice University Apollo BVM a 3D printer that just came to surface last week. And also actually at URI, we have Professor Bill Oli, which we started the meeting with, right? So we had Bill, and that was actually the first question he had, and he had something going on in his mind that he wanted to create a simplest ventilator out of the embu bag. And so he is a very enthusiastic person, and he has his garage as an innovative factory, I would say. So he actually single-handedly created a first prototype of the ventilator. So I'm going to play a video. So here he's showing us the panel, which is coming from the old, his equipment in the garage, and then he's increasing the pressure for the embu bag, and then embu bag with the compressor going on and off. And then you have this a simple plastic bag that is acting as a lung over there. So this was 1 week before that he actually created this thing. In fact, he went to Rhode Island Hospital yesterday to do a simple simulation test with his ventilator. So I'm going to play another video. So this is the same ventilator. Then he brought it to Dr. J's lab, and they have the simulation there. And then they said that it went really good. So this is actually a very simple compressor-based ventilator design created in the garage to start with. But there is a good potential in the future that can be used as a simple ventilator. And of course, he's also concerned about the FDA approval for something like that. So he has experience with the FDA before. So this is something which is happening with the Rhode Island, solver. So most of the work is done by different members. What do we want? What are we doing right now, and what are we asking for to the community? And Brian, chime in if we need more ask over here. Annette, if you think something else, please join in here too. So one thing definitely we are asking is that if you have interest in helping the community, And in this makers community, as well as if you have certain expertise, if you think that that is useful for this kind of development, please join us. And here I'm having these 3 people. I will put this in the chat after my presentation, so you can actually send us an email, and we'll put you in the group. We are also actually not just having a Google groups right now, but also Brian and other people have created Microsoft Teams for this particular thing. And so from there, now we have a much faster way to produce and communicate. The another one, if you think that there is a community that is looking for an PPE, something like face shields or face mask, please, don't afraid to connect us with them. We would appreciate that, because we are constantly looking for communities that are in need of essential, protective gears. And lastly, URI Foundation, which is an actually separate entity. It is not URI, but URI, it has another nonprofit organization, which is called URI Foundation, and which is going to launch a crowdfunding website in 2 to 3 days. And these funds will support the developments led by our Rapid Solvers group. So, if you help us spread that particular, link to your network, that would be greatly helpful. Anything else, Brian and Annette?
Yeah, I'll just add on in terms of the needs. We're actually at a point. I'm working with Dee Dee Chatham. Many of you, she might even be on here. I don't know, but to make sure that we're covering the needs of local. You saw we had the fire department of North Kingstown. Your fire departments, group homes, local clinics, as well as police department. Anybody who would be a first responder. We're looking to get those lists. And so please don't hesitate to email me. My email's up there, or contact somebody at Venture Café. They'll help to get a hold of me.
Perfect. And I would like to kind of final words from my side is that I would like to thank all this community members, what we have created. None of us are actually working full-time on this. We are all kind of putting our time in as much as we can. And many of us have particular kind of, expertise. So any kind of thing you think that may be useful over here, we would appreciate that. And I would like to thank all the people who are here and listening to us today. And I would like to thank, Venture Café for inviting me to share our experiences. I'm trying my best to represent, Rapid Solvers. I might have missed somebody's name and many organizations over here, but I think that without their help, I don't think we would be able to produce what we have been producing recently. Thank you.
Jeanette, can you just, Kunal.
Hey, Tony, how are you?
Hi, miss you. You should just give a little brief explanation of what you're doing with your engineering program and bringing in entrepreneurial programming.
Do you mean the course one, what I teach over there at URI?
Yeah, groundbreaking.
Yeah, so actually there are several things going on at URI. DD and I, we have this organization, the entity called the Innovate at URI. That's at actually higher level, university level initiative. And that is actually trying to provide an infrastructure for innovation and entrepreneurship. So that is one. The another thing that what I do at College of Engineering is that there is a engineering entrepreneurship minor program. So I'm actually coordinating that, and I teach a course called Engineering Entrepreneurship 1, but also it is slashed with the variable systems course. So we actually teach students coming from all different kind of engineering disciplines, as well as business and some other kind of science majors too. And they come together and we create multidisciplinary teams, and they actually come up with a problem that they'd like to solve, and then they create, first product prototype. And in between, a lot of like design thinking, like Jeanette mentioned, something like that happens within one semester. And it's a little bit of mixture of a lean launchpad plus engineering curriculum. So they go and also talk to people with the interview, but then they have to come back and they have to create. Otherwise, we don't feel like it is an engineering course. So they have to create something, and they have to show it to the mentors as well as judges who are coming at the end. And this course ends with a pitch competition, which is we don't give money, but at least they get some kind of they get some kind of guidance from the judges, as well as they get to network with the right mind people in the business community. Thanks, Tony, for reminding me about that.
Really great information, Kunal. Thank you so much for all you're doing and all the energy you're bringing. You're really demonstrating the power of community and industry coming together. Just a quick observation in my interactions with your group. I love the way the community is listening to the doctors. So Dr. J in particular, chiming in to provide feedback and to keep encouraging developments where, yes, medical devices need to be safe and effective, and we all, are marching toward that path. But in the meantime, the energy that and the brain power of the community in mass can get us there quicker and get us to a place where we can begin the more regimented testing. But it's really powerful to see in person and see live unfolding in front of us. So thank you again. Really, really great stuff.
Yeah, my pleasure. And thank you everyone on behalf of Rapid Solvers.